Hi, my name is Caroline Moran,
I'm Mary Lewindy.
I'm Marina Lewindy.
and we completed our Nutrition 230 video research project on the correlation between the ketogenic diet and obesity. Our research question for this study focused on the effects of the ketogenic diet, both the short and long term. We chose to focus on both of these aspects as, with any diet, the outcome really depends on whether or not the individual is able to maintain their new eating habits over a long period of time and how sustainable the diet itself is. In response to our research, we created a hypothesis that the ketogenic diet is beneficial against obesity in the short term. Since the diet is so restrictive, it can be difficult to maintain for a long period of time and would therefore likely only show results for a short time. To summarize the ketogenic diet, it is a low carbohydrate, high fat diet that induces physiological ketosis. Ketosis occurs when glucose stores from carbohydrates are low. At first, the body enters gluconeogenesis to form glucose from other substrates, such as amino acids. Oxaloacetate that would normally aid acetyl-CoA in entering the TCA cycle is redirected to be gluconeogenesis. Eventually, the acetyl-CoA that cannot enter the TCA cycle is sent to the liver to form ketones. These ketones then replace glucose as the body's main energy source, as they're able to cross blood-brain barrier, which provides energy to the central nervous system. Overall, the keto diet has been proven to have beneficial effects. Studies have shown decreased levels of LDL cholesterol and increased levels of HDL cholesterol. Additionally, the diet's high fat content provides a satiating effect, which correlates with decreased food cravings. The lack of carbohydrates additionally contributes to reduced blood glucose levels and decreased triglyceride production. Overall, current research shows short-term weight loss and reductions in BMI.
So obesity, this is just an overview of it. Obesity is classified as an atypical fat accumulation that displays a risk to the health of an individual. It is a serious disease that involves excessive body fat or adipose tissue in regards to lean body mass. Using the BMI measurement system, a person is considered a healthy weight if they're between a BMI of 18.5 to 25. And as these numbers continue to rise above this arithmetic range, one is deemed overweight if they are within the range of 25 to 30, and obese if exceeding a BMI of 30. The development of this disease results in serious health issues such as high blood pressure, high LDL cholesterol, low HDL cholesterol, type 2 diabetes, and other types of cancers. These result from increased secretion of pathogenic products from enlarged fat cells and increase in mass of adipose tissue. There are also psychological health consequences, including depression, disordered eating, social discrimination, and poor quality of life. So, this picture on the right just describes the health risks of being overweight or obese. As I discussed, type 2 diabetes, high blood pressure, heart disease and stroke, high cholesterol, gallbladder disease, sleep apnea, osteoarthritis, fatty liver disease, and different kinds of cancers. Just a continuation of this overview, the alarming rate at which the disease is increasing suggests that the source of obesity is a result of environmental and behavioral changes. Of these changes, the percentage of fat energy in the daily diet and a lack of physical activity are significant in the development of this disease. Fat is a nutrient associated with weight gain as its metabolic fate is to be stored in adipose tissue, and it results in the weakest satiety compared to other nutrients such as carbohydrates and proteins. Moreover, those factors that favor fat intake and those that prevent fat oxidation have been seen to cause weight gain. So the picture on the right here just summarizes what I discussed about the reasons that cause obesity, such as no activity, endocrine diseases, a hereditary predisposition, which we will discuss more later on, and the intake of unhealthy food that is high in saturated fats as well as sugars and salt.
So these are just some correlations between the ketogenic diet and obesity. So in a study conducted by varying researchers, clinicians looked to determine the effects of a 24-week, or rather 6-month ketogenic diet in obese patients. This diet specifically consisted of 30 grams of carbohydrates, 1 gram per kilogram of body weight protein, 20% saturated fat, and 80% polyunsaturated and monosaturated fat. 83 obese patients with a BMI, also known as body mass index, as mentioned earlier, larger than 35 kilograms, and a high glucose and cholesterol levels were chosen. Ultimately, they found that the weight and BMI of the patients decreased significantly with a p-value of less than 0.001. Furthermore, the ketogenic diet also displayed a decrease in the amount of triglycerides, LDL cholesterol, and blood glucose levels, along with an increased level of HDL cholesterol. The data in this study illustrated that a ketogenic diet served as an effective mechanism for weight reduction in obese patients. All in all, there is proven to be some correlation between this diet and obesity, as there is a satiating reaction causing a decrease in food cravings because of the high fat content of the diet. So this slide just illustrates the factors that affect weight loss on the keto diet. So some of them include eating too many carbs, eating too many calories, not eating real whole foods, not incorporating fasting, not getting enough sleep, which, as mentioned earlier, can cause sleep apnea, adrenal or thyroid concerns, not tracking ketone levels often, not being mindful of the types of keto foods, eating too many nuts, getting closer to someone's goal weight, and then high stress levels.
So this is just a summary of what we've discussed thus far. The ketogenic diet is a popular low-carb, high-fat diet. The lack of carbohydrates induces a state of ketosis, which forces the body to use ketones as its main source of energy rather than glucose. And obesity levels have been rising at an alarming rate, especially where we are today, and the health implications are very serious, as the consequences may include high blood pressure and LDL, also known as the bad cholesterol, and increased risk of type 2 diabetes. The keto diet has been proven effective for obese patients as a beneficial short-term diet, particularly under the supervision of a doctor or dietitian. But many do have difficulty following such a strict diet long term, and they eventually return to their previous or even to a greater weight after this longer period of time.
So these are just some of our recommendations that our group would make regarding the ketogenic diet and its relationship to obesity. So under the proper oversight of a physician or registered dietitian, the ketogenic diet has been proven useful for weight loss, particularly in individuals who are able to maintain the diet in the long term. In contrast, however, those who return to a carbohydrate-rich diet following the ketogenic diet are found to undergo the yo-yo effect, which is returning to their pre-ketogenic diet weight or reaching a higher weight than before. So basically they're at ground zero and they start back to their normal weight. As a result, our group would likely not recommend the diet as a sustainable tool against obesity in the long run. The process of restricting the carbs and then attempting to permanently alter the diet in such a dramatic way typically makes the diet a short-term solution with long-term adverse effects. There are some side effects to the ketogenic diet, which illustrate that there are greater consequences to the diet than there are benefits. Again, there's not much known in the long term compared to the short term. So some of these side effects include hypoglycemia, constipation, diarrhea, frequent urination, drowsiness and dizziness, muscle cramps, sugar cravings, flu-like symptoms, sleep problems, keto breath, heart palpitations, and reduced strength and physical performance. These are just some more recommendations that our group would make, more on the alternative side. So an alternative to this diet, the ketogenic diet, that our group would recommend to those attempting to combat obesity would be making small, positive, and sustainable changes to one's diet over a long period of time, such as gradually increasing fruit and vegetable intake and decreasing the consumption of added sugars. Another recommendation we would endorse is frequent physical activity, as the CDC advocates that an individual partake in about 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity per week. Moreover, we would propose the consumption of less sugary and processed foods. Those types of foods are often associated with the promotion of obesity because they are often high in fat, salt, and sugar, which can stimulate overeating as a whole. These are just some visuals regarding the weight. So in general, so incorporating healthy fats, avoiding diet foods, which often look like diet foods on the outside, but may not have much nutritional value. Drinking plenty of water, avoiding processed foods, and junk food and fast food, which is often associated with gaining weight, eating larger amounts of protein, cutting simple carbs, and eating healthier snacks.
All right, and these are our references for the study. And that's the end. Thank you for watching.